You know, there are a lot of breakthroughs for breast cancer.
Marshall Health surgeon Raman Berry joins us now once again to talk about some of the treatment options. Thanks for coming back.
Yes.
Yep, thanks for the introduction and thanks for having me here.
We're so happy to have you back because the thing about this is the diagnosis that used to mean, you know, in many ways, okay, well, this is what you have left to live. It was so different than it is now. Cancer diagnosis and treatment has changed completely.
Come a long way.
There have been dramatic advancements over the last really several decades, and you know, we'll talk to you about some of that today. You know, when we talk about kind of breast cancer care and cancer care in general, one of the main goals of the Marshall Health Network and the Edwards Cancer Center is to provide comprehensive cancer care here in Huntington and the tri-state area. And as it relates to breast cancer care, you know, we have specialized teams at every level, from really oncology nurses that are certified, specialized technicians, fellowship-trained breast surgeons, and then diagnostic modalities that are state-of-the-art. One of them highlighted here is actually 3D mammography. And that offers really some unique and distinct advantages over the traditional two-dimensional mammography. You can detect smaller cancers earlier. You can detect cancers in more fibrous or dense breast tissue. And really help avoid some unnecessary biopsies and procedures through that. And really just taking a step back, you look on breast cancer, that's the most common cancer in women after skin cancers. 1 in 8 women are expected to develop breast cancer in their lifetime.
1 in 8 now.
The numbers are really just staggering.
That is amazing.
You just think that you can make such a difference through early detection and early treatment. And with 3D mammography, and routine annual age-appropriate and risk-appropriate mammograms, really you can make dramatic improvements in outcomes.
It's just a better picture. The 3D mammography essentially gives you guys a better look to find out where the problem might be, and if in fact there is a problem. So it's got to be a huge relief to have that from your standpoint, so you have a better look at it.
Absolutely right. Makes a significant difference.
And then you mentioned prevention is what we all need to be thinking of. But if, in the case your tests come back that you do have cancer, talk about some of these surgery options and, I guess, reconstructive surgery, things that are available now that may not have been decades ago.
You know, there's no question that when someone receives a breast cancer diagnosis, that impact is enormous, both because you have a cancer diagnosis and you're really facing the potential of losing a breast. And that's where really breast reconstruction comes in. The decision whether or not to pursue breast reconstruction is a very personal one, but I think it's one that should be made really with all of the information. And plastic surgeons should be a part of the discussion early on, so people can really know what all their options are.
Right, because it is very personal, obviously.
It is,
and it's individual too. Different people have different ideas for what they want.
You know, there's really no kind of one-size-fits-all procedure for this. It is tailored based on people's unique circumstances, and you know, kind of what patients should know is whether you're having a lumpectomy or a mastectomy. There are several procedures and several options that can be tailored to your unique circumstances and preferences. But you know, really kind of putting them into 2 broad categories. After a mastectomy, you can reconstruct with your own tissue, what we call autologous reconstruction, or more commonly, really implant-based reconstruction. The key, I believe, though, is really having that discussion early and getting the patients involved. I think you get absolutely the best outcomes that way.
Sounds like
best way to do it.
Have those conversations, not only with your family, but with your physician. It sounds like you all have a whole team approach to help patients there. And we've been showing you the number right there. Give them a call. Maybe you need to come in for a consultation. Or if you haven't had a mammogram in a long time, now's the time to do it.
Absolutely. Mammograms save lives.
They do.
You know, the other thing to just mention, people always ask, does insurance cover this? And in '98, there was a federal law enacted, the Women's Health and Cancer Rights Act, that requires that if an insurance company covers your mastectomy, they're required to cover any subsequent reconstruction. And so don't let that be a barrier to seeking reconstructive advice and reconstructive care.
Terrific.
Great information.
Dr. Berry, thanks so much for coming in.
Thanks for having me.
We appreciate you being here, and we'll have you on again.